Thank you, ma'am. And now I invite Dr. Avinash Pathengey, sir, the Network Director, Academy of Eye Care Education at LVPI. He is the heart of our show. Over to you, sir.
Right. Thank you, DND, for the opportunity. And when I was thinking about the topic which was given to me, this is not something which is uh, unheard of or unsaid, but what caught my attention was choose wisely. So there's a factor of wisdom involved in it, and that's where I'd like to utilize as much as possible about 27 years of experience which I could bring into this presentation. So flip back 26 years ago, what would have been my presentation if I had to do this? So if I finished my residency, I would have said, okay, do fellowship. Okay, you can do start your private practice or into group practice. Those are three things which I would have told and I would curtailed myself. But it would have been incomplete if I had to do that today. With 27 years of experience backing me, I can suggest there are 5 career paths one can adopt once you finish your residency. One is being a clinical ophthalmologist. Second is being an academic ophthalmologist. And third is leader in ophthalmology. And fourth, you can offer yourself to work in public health. And fifth is today you can also become an entrepreneur in an industry. So these are the 5 career paths what you can pick up after you finish your residency. It's just not what I just said before, fellowship, a private practice or in your solo private practice or a group practice. Let's understand each of these in a little bit detail. In terms of academic and being an academic ophthalmologist, yes, fellowship is something which you would like to pursue, especially when you have one particular specialty which you want to specialize in. Then you can get a position of academic ophthalmology in various medical schools or university. You can become a faculty member, balancing the clinical practice, research and teaching there, or you can be a researcher also. So that's an heart and of an academic ophthalmologist position. In terms of clinical ophthalmology, you can make a solo practice, you can join a group practice, you can also enter into hospital based practice. And in community health, I want to draw your attention, which is an upcoming part, which is known as global ophthalmology, which is where you don't curtail yourself in the place where you are settled, but you have an opportunity to work in different parts of the world, especially when you are trained in 3 different resource settings which are all over the world. That is high resource setting, mid-level resource setting, and low-level resource setting. And then you have teleophthalmology, especially when you have the gender shift, when you have those years or months which is unfavorable for your regular practice. This is where someone wants to get into a teleophthalmology and still be in touch with the profession. Medical teleophthalmology or in education is something which you can still opt for. So these are 5 things in clinical ophthalmology practice. I spoke about academic ophthalmology, I spoke about clinical ophthalmology, and third about leaders in ophthalmology. So where someone aspires themselves to get into a leadership position, especially wants to become a director or a department chair, when they oversee the clinical, the educational and the research activities of the entire organization, that's something which you can try. Or want to get into a medical director's position where they curtail themselves into the clinical practice, and or as a healthcare consultant to healthcare organization, governments and so on and so forth. This is a leadership trait which one can have, but one important skill one should acquire is, if you want to get into this field and have some sort of an authority and educate yourself, pursue an MBA or LLB after your residency in this field. Now, what about public health? You can work in government agencies or in public health ophthalmology, focusing through various public health initiatives. But here, if you want to educate yourself in public health paths, pursue your MPH. That's something which is important. So I struck upon academic ophthalmology, clinical ophthalmology, in leadership. In leadership, it's better you pursue an MBA or you also have a law degree, or in getting into a public health, you can pursue MPH. And if you want to become an industry or entrepreneurship path, pursue MTech. There are courses. LVP also started a course where there is an union of ophthalmology and also the MTech, which is offered by IIT Hyderabad, where you are in a position to have a startup, or you can have an entrepreneurial skills. If you do have deep in you, you can start exploring those things as well. So that is something which you can think about in those 5 streams which is very conventional. I'm using the word very conventional as of now. Let me reiterate again: clinical ophthalmology, academic ophthalmology, leadership in ophthalmology, in public health, and then entrepreneurial part. All of this you can look at. This is something I'm still saying it's very conventional. But if you want to park yourself in a higher orbit in the future, I see these are the things which you can adopt. One is known as precision medicine, or is known as personalized medicine, and other extent is what is known as a planetary medicine, or it's a gamut of One Health. These are the futuristic medicines which are coming in vogue. Then you have the deep learning, machine learning, and artificial intelligence, where you entangle yourself with a different specialty and try to gain that sort of a competence and skill required for it. Regenerative medicine and preventive medicine. So I place my bets in all those three, in these five aspects, for something if you want to park yourself into higher orbit in the future. But that's a personal choice which you have to make. One thread which stands connected with all these different five aspects what I told you, or five different fields which you can, is they all interprofessional or transdisciplinary. The future of medicine is going to be a colleague who's going to stand next to you, who's going to be of a different profession altogether. So embrace it. It is just not going to be an ophthalmology colleague standing next to you into your practice. You'll have people with different professions coming in for a very holistic cause. So if you want to get into higher orbit, you can think about precision medicine, planetary medicine, regenerative medicine. Then you have the deep learning in medicine, and preventive medicine as well. Now, having spoken about what are the various streams available, and if you have to grace to the crystal ball what is available for in the future, I would like you to take the crossroads. And this crossroad is, if you finish your residency, the crossroads which you want about your fellowship. Every jump you have from 12th to your MBBS, you land up in a crossroad. And sometimes we don't understand why we get into medicine till we go climb the mountain 3/4 and try to understand this is the mountain which I didn't want to climb. It's just because I fell in love with biology, or my grandfather was a doctor, I get into an opportunity to become a doctor, right? It's a very emotional call which they have. And similarly, after you finish MBBS, you want to choose a specialty, it is another emotional reason. So anytime when we have to navigate between two crossroads, what we have, it has to have a lot of reverence in terms of being very practical in trying to understand by asking the right questions. So how are we going to navigate this crossroad after you finish your residency into your fellowship? I would say there are 9+1 questions which we have to ask ourselves and try to find answers to it. And when we ask these 9+1 questions, one I wrote for the only reason it's not a question, it's only when we still don't have a certainty, we can still offer or get into an institute to understand more what specialty I want to pick up by becoming an observer. Of the remaining 9, the 3 is very personal. Let me finish the very personal aspect. Is because your fellowship is going to be anywhere between 1 to 3 years, depending upon the type of organization you want to enter into. That would entail, are you ready for travel? Are you ready for relocating? Are you have any family responsibilities which you have not taken care? Or you're okay with the additional years of training and increased living costs? These are very personal decisions what you have to make. But what are the professional ones, like choosing which type of specialty you want to enter, or you want to do a comprehensive fellowship, especially when you have a residency which has been incomplete. Second is, am I interested in becoming an academic ophthalmologist? Now here where I would like to pause, and I would like to inform you the difference between clinical ophthalmologist and academic ophthalmologist. Clinical ophthalmologist who does have the clinical and the surgical competence, whereas in academic ophthalmologist it's the clinical surgical competence. They also have for education, academics, technology, so on and so forth. There are multiple other feathers which get added on to the hat to become an academic ophthalmologist. So if you want to envision yourself as a leader in one field, again, you can get into a fellowship level. It also gives an opportunity, if you are wide open to understand that it is going to increase your earning potential and job opportunities, and if you want to increase your competence. It is here where I would like to say, in an era where everybody talks about skills, there is a difference between skill and competence, and skill is very technical. right? If you have a nurse where you tell that IV dextrose has to be administered in this patient, the act of just having the cannula insertion is the skill, but why a dextrose has to be given is forms the competence part of it. The brain behind the skill is the competence, the knowledge. So skill plus knowledge in very simplistic forms the competence, and we are here to understand more about competence than skill. So anywhere go where you can get an competence. Having gotten the theoretical competence many times, sometimes you feel that if I am just have to have little bit of skill, especially for cataract surgery to build up a private practice, you can go to a center where there are alternative paths where you can beef up your skills or add up your skills in a shorter period of time. So understand what skill and competence what you want, and then you want an academic ophthalmology position or leadership position or have a wider responsibility which subspecialty you want to take. Answer these 9 questions, and if over 50% of them is congenial to what your understanding is, go for fellowship. Otherwise, I think there are other options which you have which you can pursue, and if you still don't have an answer, get an observership position to get more clarity into this. Now, before I have a couple of slides before I conclude, I want to share, I like to address certain issues, and especially if you are a person who has a profession, passion, and a purpose going in tandem, right? Then your entire life will not look at life like a work-life balance. Everything is part of it, right? And one such philosophy, which is known as Ikigai, it is followed by people of Okinawa. It's one of those blue zones what is available in the world. And what they have is a 4 circles which intersect, and the center is Ikigai. And those 4 circles, the first one is what you love to do, and then you have what you're good at, and then does the world require one, and last is who pays for it. So there's a financial component also to it. So let me repeat: what you love to do, what you're good at, does the world require one, who pays for it. And if I have to do it myself, when I've done, you have to take a couple of years or even months to understand what I'm good at. I'm very good at in vitreoretinal surgeries. Then I'm good in treating in posterior segment infections. What I love to do is making people better in life. I love to learn. So that is something which I'm just filling up these circles so that it will help you to fill up circle by yourself. Does the world require a person who can teach and make people better, at the same time heal people with vitreoretinal diseases? Certainly yes. And who pays for me? It's my LVP, the working organization, which is going to pay for me, right? So you try to do it yourself, then you'll become a person whose profession and purpose are very much aligned and works in tandem. And before I end, I will say this decision which you make has to be made with introspection, and it's your own decision, and it's a personal choice. And I would like to say that all of you are unique. You don't have to emulate anyone else 100%. You can observe, you can listen, but since all of you are unique, you're born with your own talent to make a mark in this world. You just don't have to copy or emulate just because that person has done fellowship. I would like to do fellowship. If this person has done something in cataract, I would like to do something in cataract. Understand yourself, understand your personality, and if it is someone who is going to break the walls and try to make something different into the world, then you can opt for something what I just suggested. If not, you want to do something what everybody has done, nothing wrong with it, but whatever you do it properly. With this, I end my slides. Thank you very much for your patient listening.
Thank you, Dr. Avinash. Thank you for delivering this talk, and thank you for flying from Visak to